I'm Daniel Levine, and this is the Bio Report. Scientific breakthroughs, innovations in technology, and the changing use of data are among the forces that are driving disruptive changes to healthcare. A new report from the IMS Institute for Healthcare Informatics highlights a number of these developments and what they mean for the way healthcare is accessed and delivered. We spoke to Murray Aitken, Executive Director of the IMS Institute for Healthcare Informatics, about the report, how these developments are reshaping the healthcare landscape, and how they are altering the role drugs will play in advancing health. Murray, thanks for joining us.
Thanks, good to be here.
Last month, the IMS Institute for Healthcare Informatics issued a report that highlighted a number of developments that are signaling big changes to the healthcare landscape. This ranges from technological innovations to the way information is being captured and used. We're going to drill down into some of these, but I found the report rather optimistic about the changes these forces are driving. In broad terms, can you begin by just telling us how you see healthcare transforming? What are we changing from, and what are we changing to?
Sure. So what we're picking up on is really the combination of changes that we see happening around science and technology, the availability of information and the ability to access and use it. And we're also picking up on a greater engagement by patients directly in their own healthcare. We think that those three broad trends come together in a way that we think is positive for bringing healthcare systems to a more rational place than they may have been. We also think it's positive for the role that medicines play within health systems, not just in the U.S., but globally.
Well, we seem to be at a turning point with digital health as smartphone makers have embraced the role their mobile technologies can play in healthcare. What are the big players like Google, Apple, and Samsung doing in this area, and what does it mean to have them make a concerted push into healthcare?
Well, we think that their announcement of their intentions and entry into healthcare in a big way is significant to the extent that they bring not only the companies themselves but the entire ecosystems that surround these juggernauts, and to the extent that they are putting their focus on healthcare. We think that this will accelerate the development of a range of applications and technologies and hardware that will bring patients more intimately involved in their own healthcare, that will generate streams of data that will be of value by healthcare professionals as well as the patients themselves, and that we think will also move the needle in terms of removing a lot of the inefficiencies we have in the healthcare system, where we have a lot of healthy patients visiting doctors without necessarily needing to. And these kinds of consumer-friendly technologies can help avoid that. We see these companies providing new technologies that will help patients become more engaged in their healthcare, generate more information of value to healthcare professionals, and bring efficiencies to the operation of our healthcare system.
Though digital health technology can have an impact on personal behavior and helping people become more active or more compliant with their doctor's orders, the real payoff for this technology is to get the data from the individual to the provider who can monitor health and intervene when there are indications that problems are brewing. What's it going to take to get us to the point of integrating this data into patient records and what providers are doing, and what will the payoff eventually be?
certainly the integration of data from disparate sources into the electronic health record or some other central repository is a key issue for these technologies being accepted by providers, and they're very clear on that. I think we need to have the providers and the payers, for that matter, put more pressure on the EHR vendors to ensure that their systems are able to integrate information that's flowing from third parties and from these apps. So I think that's one area that still needs more attention and more focus. I think in addition, the development of the sort of algorithms that lay on top of the information flow, the raw data flow, so that the information that ends up in the electronic health record or being brought to the attention of the healthcare professional is useful information. And not just all of the information. So I think those sorts of algorithms to define what data signals indicate some level of intervention are important to be more fully developed than they are today. But I think, again, this will be a focus as the data becomes more available. I think the payoff is going to be in terms of helping healthcare professionals manage their patients more efficiently, reducing the need for in-person checkups and testing. And I think that can really move the needle in terms of efficiency of the healthcare system.
Any cost estimates we could put on this in terms of savings?
I haven't seen any specific costs, except whenever we look at the total cost of care for any major disease areas, the cost of patients visiting doctors for the checkup, for the next set of tests and so on is always a very significant part of that cost, and I think there's a good part of that which can be avoided if this all comes together in the right way.
Well, another harbinger of change you discuss is the innovation we've seen in hepatitis C therapy with the advent of Sovaldi and other new drugs approaching the market that provide cures. These breakthrough drugs, though, because of their high cost and big markets, are highlighting tensions between the long-term benefits they provide and the realities payers face with their annual budgets. It's easy to imagine not only gene therapy or stem cell treatments leading to new cures, but breakthroughs in treatments of diseases such as Alzheimer's or diabetes leading to great debates about how to value and pay for these therapies. How have the new hepatitis C drugs reshaped that discussion?
Well, they're certainly bringing a great deal of attention to this issue of how do you pay for a cure, essentially. And this is a debate not only in the US but around the world as these drugs become available. I think it shines a bright light on the way in which drug budgets are set, the extent to which there is siloed thinking about the cost of medicines relative to the costs of other services within the healthcare industry, and perhaps speaks to the need for there to be a different way to finance cures, as opposed to the way that we finance chronic diseases. So one can imagine that just as in the when one buys a house, typically cash is not paid up front, but it's paid off over a 30-year period. Maybe some type of approach like that needs to be established for these cures that bring immediate benefit, but also bring an immediate cost that is otherwise difficult for a health system to absorb all at once. I think the broader issue here is we still have payers and the health system more broadly thinking in silos about cost components rather than thinking about the total cost of hepatitis C as a disease, or the total cost of diabetes, or the total cost of hyperlipidemia, and a more holistic sort of horizontal view of the total cost we think is useful to help make judgments about where to spend more and where to spend less, particularly as some of these innovative treatments and indeed cures come out of the R&D pipeline.
I take that problem is perhaps more exacerbated in a system like the U.S. where there's not a single payer. How much of an issue is just the reality that even though there's an argument to be made for having a long-term holistic view on healthcare, there's the reality of the annual budget and the fact that my patient today may not be my responsibility 3 or 5 years out.
Right. So this remains an issue, certainly in the U.S. healthcare system. I'm not sure we're going to see any significant direct change to that certainly not in the near term. So, I think this will remain a pressure point, and certainly the Hep C cluster of innovation that's coming along is putting a lot more pressure in the system there.
Well, the last issue I want to touch on from the report is the use of data and the move towards data transparency. We've seen some interesting developments along these lines, ranging from Europe's push to make clinical trials data available to the Centers for Medicare and Medicaid Services release of payment data for procedures and services. What have we seen so far about the availability of this data to actually change healthcare?
Well, I think we still see more potential than real impact to date. I think we're still at the early stages of knowing what to do when these large data sets become available. I think earlier this year when we saw the Part B data released by CMS, that no one really knew what to do with it. And I think this is a process we'll work through to be able to generate the insights and the understanding of how healthcare is actually practiced, and to use that information to make more informed decisions about where there can be efficiencies in treating patients, and where the effectiveness of various treatment options can be identified and reinforced. So, our view is that increased availability of data is a good thing. Granular data is very powerful. There are effective ways to encrypt data so that patient privacy is not compromised, while at the same time providing granular information to analyze and to combine with other data sources. So I think we're still in the early stages of seeing how this will play out, but I can well imagine within the next 3 years or so that we'll see new kinds of findings in terms of looking at the effectiveness of different treatment approaches, looking at new ways to find efficiencies in the healthcare system, as well as to identify potentially new kinds of therapies and treatment options to address unmet needs. But there's more work to be done. The good news is the progress that's being made in terms of making more data availability is occurring, and again, not just in the US, but in Europe, in South Korea, for example, as well, as we noted in our report. So we are excited about the opportunity that this will bring.
Well, we appear to be on the cusp of unleashing data that is right now siloed and capture new streams of data that are all around us. Where do you see the biggest payoff from this? Is it going to be improved public health, greater efficiency, faster, cheaper development of drugs?
I think I think we'll see a big payoff in terms of efficiency. I think we all know that there are significant inefficiencies in the way in which healthcare is delivered. Today, we issued a report earlier last year on avoidable costs in the U.S. healthcare system that are directly linked to the way in which drugs are used inefficiently, shall we say. And the numbers are always big. So we know the opportunity is there. It's just always difficult to put your finger on exactly where is it happening and what can you do about it. I think the this availability of information occurring at the same time that we're seeing significant changes in the way in which healthcare is delivered, the consolidation of providers, the relationship between providers and payers, the shift from fee-for-service to outcomes or performance-based measures. I think all of this comes together at the same time to enable us to wring out those inefficiencies, whether they be in inefficiencies caused by patients not being diagnosed in a timely way or not being treated in a timely way, or inefficiencies in the diagnostic tools that are used, the medicines that are used, the frequency with which they have to visit their doctor, or indeed in the post discharge. When patients are discharged from hospitals and return to community care. These are all areas we know that there are significant inefficiencies, and I think the availability of the data combined with the shift to a more acute focus on performance and outcomes will enable those efficiencies to be wrung out of the system.
I mentioned the report was rather optimistic, but in order for these changes to bring about their expected benefits, what are some of the challenges? For instance, I think of big challenges to capitalizing on the availability of data ranging from interoperability to privacy concerns. There are also many competing economic interests at play in healthcare, with shifts in power between payer and provider, patients, and drug makers. How big are the obstacles to getting better care at lower prices as a result of the harbingers of change you highlight?
Well, we think that those barriers are being lowered partly through the scientific and technological advances that we talk about in the report, but they're also being lowered as the realization that we spend a lot of money on healthcare becomes ever more acute, and the urgency to address that spending to ensure we have a rational healthcare system and that we're spending the money we're spending in a rational way, I think helps to bring those barriers down even lower. And part of that underpins our optimistic view that change is happening. It's facilitated by technology, by the science, by the information, and so on. It's also facilitated by the growing awareness that we can do things in a more efficient way and also deliver better outcomes at the same time. So hence our optimism that this will come together and lead us to a brighter future, and one where we would also say the role of medicines becomes more significant both in prevention as well as treatment of disease.
Well, one of the things you do highlight is the changing role of medicines as a result of these other forces. How do you see the role of drugs changing as healthcare changes?
Well, clearly we have a lot going on in R&D that is coming into the marketplace and becoming available to patients, whether that be the cluster of innovation around hepatitis C, the malaria vaccine that's coming through the pipeline, or all of the oncology advances that are also coming through R&D. So there's a growing role for medicines simply based on the fact that we've got more breakthrough medicines that can address unmet needs. In addition, I think the other harbingers we talk about with respect to the patient-related technologies and the use of data will put more focus on timely treatment of patients and appropriate use of medicines, and addressing the long time issue of patient adherence. If you add those together, then I think we can see a growing role for medicines in a more efficient healthcare system. So I think, again, from both of those angles, we see a positive outlook for the role that medicines play and the markets for those medicines going forward.
Murray Aitken, Executive Director of the IMS Institute for Healthcare Informatics. Murray, thanks as always.
Thanks, it's a pleasure.
Thanks for listening. The Bio Report is a production of the Levine Media Group. To automatically download this podcast each week, subscribe to our RSS feed or through iTunes or other podcast manager. To join our mailing list, go to levinemediagroup.com. We'd love to hear from you. If you want to drop us a line or are interested in sponsoring this podcast, send an email to danny@levinemediagroup.com. Special thanks to Jonah Levine, who composed our theme music, and the Jonah Levine Collective, which performs it.